friends, today we will be studying prostaglandins. So prostaglandins, these are also known as eicosanoids. So why these are called eicosanoids? Because these are synthesized from arachidonic acid. And what is this arachidonic acid? You might have read in the first year. It is also known as eicosanoic acid. So this eicosa means what? It is 20 carboatom and tetra means there are 4 double bonds. Okay. So how these are synthesized? So coming to the synthesis, कैसे होता है? पहले आपका ये for example cell membrane है. Okay. So this is your cell membrane. So this cell membrane, it contains membrane phospholipids. So when there comes a signal to this membrane phospholipids, this is acted upon by an enzyme. कौन सा एंजाइम एक्ट करेगा? फॉस्फोलाइपेज A2 एक्ट करेगा. सो एक बार आपका मेम्ब्रेन फॉस्फोलिपिड के ऊपर अगर फॉस्फोलाइपेज A2 एक्ट किया तो आपका फॉर्म होगा कौन सा एसिड? आराकिडोनिक एसिड. ठीक है. तो आराकिडोनिक एसिड से आपके प्रोस्टाग्लैंडिन्स और ल्यूकोट्राइन्स सिंथेसाइज होंगे. ठीक है. तो आराकिडोनिक एसिड से कौन कौन सा पाथवे हो सकता है? यहाँ पे मैं लिख देता हूँ arachidonic acid. So from arachidonic acid there are 3 pathways. एक होता है आपका COX pathway और it is known as cyclooxygenase pathway. COX और cyclooxygenase pathway. ठीक है. तो इससे क्या सिंथेसाइज होगा? प्रोस्टाग्लैंडिन्स. दूसरा होता है आपका 5 लाइपोऑक्सीजनेज एक्ट करेगा. ठीक है. और लॉक्स पाथवे में आपका सिंथेसाइज होगा ल्यूकोट्राइन्स. ठीक है. तो ल्यूकोट्राइन्स LTA4 जिससे सिंथेसाइज होगा LTB4, LTC4, LTD4 और E4F4. ठीक है. उसके बाद और एक पाथवे है जिसके द्वारा आपका लाइपोक्सिन्स सिंथेसाइज होता है. ठीक है. So that basically we will concentrate on these two pathways, that is COX pathway and LOX pathway. So COX pathway is responsible for synthesis of prostaglandin. So what are these prostaglandins? PGG2, then there is formation of PGH2, and from this PGH2 there will be formation of, by the action of the enzyme isomerase, thromboxane synthase, and another enzyme is there which is known as prostacyclin synthase. Okay. So this thromboxane synthase, as the name indicates, you can remember, ये synthesize करेगा TXA2. Okay. Prostacyclin synthase will synthesize PGI2 and isomerase will gives rise to PGD2, E2, F2 alpha. Okay. So prostacyclin PGI2, as the name indicates, it will inhibit the platelet aggregation, and this is also causes vasodilation. Okay. Thromboxane A2, A is there, so it will cause platelet aggregation. It is a vasoconstrictor. Also, it will also cause bronchoconstriction. So clear about all this? So basically, from membrane phospholipids, all your prostaglandins are synthesized. So what happens? The membrane phospholipids, when it is acted upon by phospholipase A2, arachidonic acid is formed. Now this arachidonic acid, it has got two pathways. Either it can go in the cyclooxygenase pathway or it can go in the lipooxygenase pathway. So in the cyclooxygenase pathway, there is formation of this prostaglandins. Okay. In the lipooxygenase pathway, there is formation of leukotrienes. So what are the prostaglandins and how they are formed? So first the COX enzyme is acting and then there is formation of PGG2, then formation of PGH2. Then there is action of isomerase, thromboxane synthase and prostacyclin synthase. Isomerase gives rise to PGD2, E2, F2 alpha. Okay. Prostacyclin synthase, PGI2 and thromboxane synthase, thromboxane A2. So A for A, remember. So thromboxane A2 causes platelet aggregation, vasoconstriction and bronchoconstriction. PGI2, I for I, you can remember, inhibits platelet aggregation and causes vasodilatation. Okay. So now coming to different prostaglandins. So what is the action of PGE2 first? So PGE2 is responsible for maintaining the gastric epithelium. Apart from that, it has got platelet function, kidney function, regulation of blood flow, vasodilatation, bronchodilation, and uterine stimulation. Okay, coming to PGD2. So what this PGD2 does? It is a vasodilator and it is bronchoconstrictor. Then coming to PGF2 alpha. ओके सो PGF2 अल्फा क्या करता है हमने पढ़ा था इन ग्लूकोमा ओके सो इन ग्लूकोमा दिस PGF2 अल्फा एनालॉग्स दिस इंक्रीज द uveoscleral outflow okay and therefore it is used in treatment of glaucoma apart from that this also cause bronchoconstriction and uterine stimulation okay so generally, whenever we talk about the prostaglandins, we need to know that these prostaglandins, these all are inflammatory mediators. Okay, PGs, these all are inflammatory mediators. Okay, so as because these are inflammatory mediators, this will cause inflammation, pain, fever, these kind of symptoms whenever they are released. So these are contraindicated. The analogs of prostaglandins, these are contraindicated in inflammatory conditions like inflammatory bowel disease. The topical eye drop preparation are contraindicated in inflammatory conditions of the eye like anterior uveitis with glaucoma. Okay, and these uterine stimulants, these are also contraindicated in case of pregnant women. Okay, like misoprostol is contraindicated in pregnancy. Okay, if given for peptic ulcer. Okay, so what are the adverse effects of this generally? Adverse effects of prostaglandin generally. So this is nausea, vomiting, diarrhea. Then there are uterine cramps because of uterine contractions. So there will be manifestation as abdominal pain. Then there can be fever, there can be pain. On injection, there can be pain also. Then there can be headache. Flushing can be there because of vasodilatation. Okay. So the most important thing in this chapter is the various prostaglandin preparations. Okay. So we'll make a table of it. एक टेबल बनाएंगे जिसमें हम लिखेंगे पीजी, उसका प्रिपरेशंस और analogs, and then we'll write the various uses. So in this way we can remember easily. So first coming to PGE1. Okay. So the analog is, first analog is misoprostol, which I have told you. Okay. So misoprostol, what is its use? It is used in peptic ulcer disease. Okay, particularly in case of NSAIDs induced gastritis. Okay, as because PGE1 is responsible for maintenance of the gastric epithelium. Okay, then apart from it, it is also used in cervical priming, postpartum hemorrhage. Also, it is used in medical termination of. So here, a question based on case can be asked. Suppose a female patient with pregnancy presents to you with NSAID-induced gastritis, and can misoprostol can be given in this patient or not? So in this patient, as she is a pregnant case, okay, if you will give misoprostol, there will be medical termination of pregnancy. So misoprostol is contraindicated or avoided in this case because it will cause the uterine stimulation. Okay. Second analog is alprostadil. Okay. So as because there is dil in this, so it will be used in some case of, okay, cardiovascular system. So where it is used? It is used in to open the patent ductus arteriosus. Okay, there is certain times there is patent ductus arteriosus, and to keep it patent in case of transposition of great arteries, alprostadil is used. Apart from that, alprostadil is also used in case of erectile dysfunction. Okay, so alprostadil, as because dil is there, it will be used in some condition of the heart. Dil है तो heart में use किया जाएगा. So it is used in to keep the ductus arteriosus patent in case of transposition of great arteries. Apart from that, it is also used in erectile dysfunction. Next, another drug is there, that is Gemeprost. It is also another analog of PGE1. Okay, it is used for cervical priming. Okay, so PGE1 is over. Now coming to PGE2. So what are the analogs? The analog is dinoprostone. Dinoprostone. Okay, so what is the use of dinoprostone? It is used in induction of labor, induction of labor, mid-term abortion, mid-trimester abortion. It is also used in postpartum hemorrhage. Okay. Next coming to PGF2 alpha. Okay. So PGF2 alpha, what are the various analogs? Dinoprost. Okay. and 15-methyl PGF2 alpha, or it is also known as carbo roast. Okay, so these are used in midterm abortion and in controlling the postpartum hemorrhage. Now, as because this cause the adverse effect of bronchoconstriction, yes or no? We have read it previously. PGF2 alpha causes bronchoconstriction. So, in the cases where there is asthma, it is contraindicated in case of bronchial asthma. So this history has to be taken very carefully. Whenever you are giving this PGF2 alpha analogs in the case of PPH, or if you are prescribing it for midterm abortion, if the case has got bronchial asthma, you should not prescribe the PGF2 alpha analogs. Coming to, there are certain topical preparation eye drops which are used in glaucoma, which are the analogs of PGF2 alpha. And what are these? These are latanoprost, bimatoprost, travoprost, and uniproston. So, latanoprost, bimatoprost, travoprost, and uniproston. Okay, these are used in case of open angle glaucoma. And what is their mechanism of action? They increase the uveoscleral outflow. क्या करते हैं ये लोग? They increase the uveoscleral outflow in case of open angle glaucoma. So this topical preparation, they can be given safely in case of asthma also. Okay, though they are avoided, they can be given. But this dinoprost and 15-methyl PGF2 alpha, these are contraindicated in case of bronchial asthma. Now coming to PGI2. So PGI2, the preparations are epoprostenil, treprostenil, and iloprost. Okay, so all these are used in case of pulmonary hypertension. Epoprostenil, treprostenol or treprostenil, and iloprost. These are used in case of pulmonary hypertension. Okay. So now coming to, how will you remember by means of a mnemonic the actions of PGs? So the actions of PGs are all P's and a single G. What is the single G? It is glaucoma. And in this, which are used? PGF2 alpha analogs like latanoprost, bimatoprost, travoprost, uniproston are used. Apart from the, what are the actions? In case of uterus conditions, okay, it is used in abortion, cervical priming, any analogs are used. In case of induction of labor, okay, in case of PPH, in erectile dysfunction, alprostadil is used, okay. So in case of GIT, it is used for promote ulcer healing. In peptic ulcer disease, increase the peristaltic movement. It has also got a purging effect. Then to prevent the platelet aggregation. It is mediator of inflammation, so it causes pyrexia. Okay, it causes pain by sensitization of peripheral nerves. Okay, then It is also used in pulmonary hypertension. Which drugs are used in pulmonary hypertension? PGI2 analogs like ipoprostenol, treprostinil, and iloprost. Okay. Then to maintain the patency of the ductus arteriosus. To maintain patency of ductus arteriosus. In which case? In case of transposition of great arteries. Okay. So there are a lot of P's and a single G. So lot of P's are preventing platelet aggregation, pyrexia, pain, pulmonary hypertension, patency of ductus arteriosus, peristaltic movement, peptic ulcer disease. Then there is a single G like glaucoma. Okay, so this way you can remember the prostaglandins. Okay, and the most important thing in this chapter is the various analogs of prostaglandin, which is usually asked. Okay, so what are the analogs you need to remember? So that's all for this lecture. Thank you.